And there we are. That should be us live for a very exciting week 3 of Joint School. And I'm delighted to again have Helen with us to take us through some exercises again. This week, we will be building on what we've been doing over the past few sessions. So we started with a bit of a general, gentle exercise and relaxation session for both hips and knees, really applicable to anyone with hip or knee arthritis, or who is at the various stages of getting ready for joint replacement surgery or on the road to recovery. But starting off quite gently. In the second session, Helen took us through a progression of these exercises, so it's a slightly more advanced workout, and again with a nice relaxation session at the end. And so here we are for number 3, and today, sort of as requested, really, we've had a few suggestions in, and please do send more suggestions for topics, for interviews, for questions to answer, and we've had some good ones of those as well that we'll cover. But so today what we're doing is a set of exercises again, but more focusing on the knees, and again this is rather a gentle set, but focusing particularly on the knees, so applicable for those with severe knee arthritis perhaps, or who have recently had knee replacement surgery and so on. I'm sure Helen will be able to tell us a bit more when she joins us on the video. Here we are. Welcome back, Helen.
Hello. Hi. Thank you very much for having me.
No, thank you. Absolute pleasure to have you with us. So I think before we dive into this week's set of exercises, I don't know if you're happy with the introduction to the workout, or is there anything else you'd like to add?
No, I will introduce it when we come to it. I think
Okay.
let's get on with, we'll do the questions first.
Yeah. Okay, that sounds good. Yeah. So before we dive into the workout, as I said, we've had some great questions, and please do keep sending them in. 2 questions that we're going to cover today. So the first one was an interesting one about cryotherapy, so the application of ice, which can take many, quite a wide range of forms and variations, and you'll be able to say much more about that. So that's why we're here, to dig into your knowledge and experience about these things. But particularly for the rehabilitation and recovery from joint replacement surgery, and especially in this case, hip and knee replacement surgery, what is the merit, do you find, or the role for cryotherapy and using ice?
Yeah, I mean, ice is definitely something that is used in the early days. If you're in hospital, you usually get given some sort of ice. It's usually a cryo cuff, and you can sometimes take those home from the hospital, or get your own from the internet. So that is definitely something which helps symptomatically to do that. Certainly for the first couple of weeks, you need to be using it very regularly. I usually suggest that you use it 10 minutes before you do your exercises, and then maybe for 10 minutes after you've done your exercises. Or if you go out for a walk, again, I would use it for 10 minutes or so after you come back from your walk. That's in the sort of first couple of weeks. There are various things on the market that you can get these days. Something called Game Ready, which you can hire, but it's expensive, but that's something that you can look at if you're interested. So yeah, those are sort of, but an actual ice pack for a knee is perfect, really, and does the job well for what you need. I think if you're an elite athlete, then obviously people look at different things, but I think in these circumstances, we're just talking about ice, and the research suggests that ice is a good thing in the early days, and also for symptomatic relief later on if you're getting swelling when you go for a walk, or when you overdo it doing your exercises. Ice is certainly a good thing.
And I guess it's important to always flag. I've always got the little safety flag going. So I guess for most people, ice would mean an ice pack. So something that you could buy from a shop and use. You can even make them yourself at home. And I think hopefully one session we might do a bit of a Blue Peter thing where we go through how you can make your own ice packs. But of course, many people may already be well aware that a bag of frozen peas can do a really good job too. But always take care, never directly onto the skin, and with something like a damp tea towel in between, and not for too long. I think, am I right in thinking that most people would recommend sort of 15 to 20 minutes at most?
Yeah, 15 minutes. You're using an ice pack out of the freezer, like bag of peas. To be honest, it will gradually get a little bit cooler anyway. So as long as you've got your towel and not putting it directly on the skin, it's unlikely that you're going to get a burn from overusing it. But yeah, 15 minutes is plenty for ice.
Yeah. And I guess they will get a little bit warmer as they sit there. But I guess the benefit of these specific sort of specialized pieces of equipment, these machines, the CryoCuff, Game Ready, there may well be others. We're certainly not sponsored by any of them.
No.
But they seem to be the most common ones. But there are others as well.
But they remain cold for the whole session that you're using, which is different to an ice pack out of the freezer.
Yeah. And some of those may then have programs where you can wear it for longer and so on, and it can get quite specialized. And but it's always good to follow the instructions with that. And then I guess there's the next step, which is even more advanced stuff, and ice baths and which are all things that can be applied. But
I think the ice bath is something that that's what I'm sort of thinking about with a sort of athletes and when you're getting back to sport, rather than in those early days of rehab. I think what we're talking about now is really those early days when you want to have the pain relief, you want the swelling to go down. A normal ice pack straight from the freezer is absolutely fine. CryoCuff is probably the next stage up because it's clean and easy to use. But otherwise, I think an ice pack's great.
And you mentioned some of the research around this. I think there's also been some studies that perhaps have called into question how or even whether ice packs actually do help. But I think they've been used for so long, and there's also something about giving yourself, giving people some kind of agency and control and the ability to do something, and I think that in itself can be psychologically beneficial, even if there are some questions around the physiology of exactly how it works.
Yeah, I think that's right. I think the physiology, there's question marks around it, but certainly from a subjective view, it certainly makes your knee feel better. We're having an ice pack on it for 10 minutes. If it feels warm and a bit swollen, it definitely makes a difference. Seen that in patients, and I'm experienced it myself. So but I think as far as the actual physiological, if you want to go into science of it, obviously there's a bit of controversy about it. Hence the reason why not everybody's using ice baths now after they've played their round of golf or play tennis or whatever. Yeah.
But generally speaking, if it feels good, and you're doing it in the right way, so that it's not causing any harm, then why not?
Yeah.
Yes. And perhaps worth giving a quick note also to elevation, which would often go hand in hand with applying ice to control pain and swelling.
Yeah, I think elevation is really important for helping with the swelling. I always tell my patients that if they haven't, if they're not moving around and doing their exercises, then they should have their leg elevated following a knee replacement. So definitely for the first 2 weeks, and probably for up to the 6 weeks, after they've been for a walk, they will probably need to put their leg up for, a couple of hours or so. Yeah.
And how high is high enough in terms of elevating a leg after a knee or hip replacement?
It's interesting you say that. Everybody always says that your foot should be higher than your heart, all sort of high up. But actually, I found that actually just having your knee comfortably up on a couch, sofa, poof, supported by pillows, and then putting the ice pack, or not even the ice pack, just having it there, is actually plenty. That's what you want. You want it to be in a rested position that's off the floor, so you don't have that gravity effect.
Yeah. So generally speaking, trying to avoid sitting with both legs down for any long period of time.
Exactly. Yeah.
And that feeds into what Brogan and I were talking about earlier today, around reducing the risk of blood clots after surgery, and indeed that's something that that's a factor there as well. Sort of trying to avoid letting the legs kind of sit and the blood.
Yeah, cool. Yeah.
Gentle, regular movements, not doing too much, and a bit of elevation, and trying to get up and moving about.
Yeah, indeed.
Now, and the other question that we had sent in, quite a different one, but also to do with recovery after joint replacement surgery, and particularly knee replacement surgery. And I guess perhaps more so with knee replacement than with hip replacement, people might encounter the idea around measuring or working towards the range of movement and achieving certain key milestones or key checkpoints, so to speak, or key amounts of a range of movement. And this particular person who sent in the question, they're just a bit concerned. They've been doing some reading about what the things that can happen after knee replacement surgery, and they're wondering about, well, if they don't get enough range of movement. They've heard about this thing called a manipulation under anesthetic or under anesthesia that might happen, and she's wondering, how do I know if I'm one of those people that might need that, and what can I do to avoid that?
Right. Yeah. Okay. So after you've had a knee replacement, most people will get quite quickly up to 90 degrees, sort of 80, 90 degrees quite quickly. Then you get that sort of static, not getting very far, and then you move up again. And normally you get, about 130 degrees over probably 6 months to a year. If things are moving, so
indication that's 90, and then I don't know, is that?
So we're looking at 100. That's what we're talking about with 130. Sorry, we work backwards with our 130. That's 90. That's north, and that's sort of your 130. So that's what you're sort of aiming for. Sorry, lost my train of thought a bit. So you gradually work up to that, and it takes about 6 months to a year to get your full range that you're going to get if you keep plugging away. Some people find that between 3 and 6 months that they get a plateau effect, and it doesn't move on from there. And they may be stuck at 100, and it's a bit, still a bit swollen, a bit stiff, and they're just not getting enough, and they can't do the stairs and things like that. That would probably be an indication to go back to have a review with your surgeon, discuss with him your problems, and if there's anything that he can do to help. Sometimes earlier on, you don't make the progress that you should for whatever reason. We don't understand why. And some people don't get beyond sort of that sort of 60, 40, even 40, some people have been stuck at, I've known, and they just can't get beyond that. Again, we don't know why, but that does happen sometimes. And that would be you probably would go back for your 6-week check, and the surgeon would probably want to review things, perhaps under anaesthetic then. So there's 2 areas at times that you would look to do a MUA. One would be early on. If you've got very little range, you can't get to 90, that you probably intervene earlier. If you can get to 90, but then you struggle to get that next stage, then that would be a later intervention, because we know that can take a bit longer.
Yeah, and I guess before people start worrying too much about it, it's worth saying that it is, it's fairly rare to need to go back to have that range of movement sort of improved by your surgeon. And for those now who may not be able to have a face-to-face 6-week appointment, I think often the surgeon or the team will be able to get a good understanding or handle of how movement and things are improving. A lot of it just by speaking, but certainly over a video consultation as well, or perhaps with people can take photos if need be of what their movement is like and how they're getting on.
And I think the other question was regarding, what was more important, the bending or the straightening, I think we talked about earlier. And basically, mostly the extension or the straightening of the leg comes as you walk. One of the surgeons I used to work with just described it as sort of kicking it out over time, and that he was never particularly concerned that, and usually by the sort of year, most people have got their full extension. some people get it really very quickly. I had someone before the lockdown and she had full extension within a couple of weeks. So you have those variations. I think it depends on the soft tissue contractures that you had behind your knee, with your hamstring and your gastrocnemius muscles, your calf muscles and your thigh muscles, how tight they get, because you've got a knee that's not quite straight when you go to surgery.
Yeah.
So that will be dependent on that a little bit. But on the whole, the bend, so if that's the case, if you're getting a bit stuck with getting extension, then definitely working towards your bending, the flexion of your knee is something that you should be working on, definitely. But the other side of it is if you really get your quads working. So if you really work hard at getting your quadriceps, which are your thigh muscles, working early on, then that really helps with the bending as well.
Yeah.
It sounds silly to say if you're straightening your knee, it helps your bending, but actually the evidence does say that if you get a good quads control early on, then you'll get good flexion.
Okay. So I guess as is often the case, it's about doing a little bit of exercise quite often, following a program, listening to the body, and trying to progress, not pushing too hard, but keeping moving as best we can.
Yeah.
And I guess.
And there are various things. There are various things you can do to help with the extension, like resting with your leg without your knee being supported for a very short time, and then gradually building that up so you don't hurt yourself doing it. It's not supposed to be an ow situation, because you'll just have the opposite effect. The knee will sort of react against being pushed for a long length of time into one's position. Like if you bent your finger back for half an hour, it would hurt. So you don't want to do that with your knee either. But equally, some short length of time, it's quite good to give it a bit of a stretch, and that will help with getting the extension. But I wouldn't advocate sitting, like that all the time. I would definitely be comfortable for most of the time, because as I say, otherwise you get that opposite effect, and you just get a really sore knee.
Yeah, super. And I guess perhaps it's worthwhile, just before we head into the exercise, just to do a quick recap of some of the terminology there, because I know it can be a bit confusing. But so, one of the key things that people aim to achieve after knee replacement is full straightening or full extension. So that's the fully straight leg, and that's typically what we'd say 0 degrees, although you can actually go, but for simplicity we'll say 0 degrees, and then bending down to right angle, so bending down being flexion, and then bending down to right angle 90 degrees, and then beyond that, and we want to achieve 90 degrees and then a good bit beyond that as well over time. Super. Is there anything else you'd want to add on those points? We've covered a bit of cryotherapy and a bit of range of movement after knee replacement surgery, and so on. Anything else you'd want?
I think that's fine. All I would say that if you are worried about your progress, you should always contact one of your medical advisors, whether it be your surgeon or your physiotherapist, because they're the ones who know you best. They've done the operation for the surgeon. Physios will have been working with you. They know whether you should be making better progress than you are. So don't hesitate to voice your concerns, because you can either be reassured and say, actually, this is normal for you or for everybody, or you're actually ahead of the game, or you're actually a bit behind, but you will catch up. So it's good to do have these conversations. Don't hold back, because that's what we're here for.
Fantastic, thank you. That's exactly what I should have said about a minute ago. I think my safety must have just slightly come a kill to them. But thank you. That's a very, very important and good point. Yeah. Super. Well, what I'll do, I'll sort of let you take the reins of the rest of the session, and I'll be there at the end.
Okay.
And I'll be following along as best I can.
Yeah. Great.
Right.
Good stuff. Okay. Thank you. Great. Okay. So today I've been asked to do a fairly basic exercise program for people who are very early on following their knee replacement or are waiting and have actually got quite sore knees. So some of the exercises that you've seen me do before may have been a little bit too much for you. And so these are quite simple exercises, but they keep the whole body. I'm very into keeping the rest of you going. I think it makes a big difference to how you feel and also how the rest of the body responds. And I think it does help with preparing you for surgery. I think it also helps when you're just recovering as well. So the idea is to keep the whole of you going, not just worrying about your knee, as we're talking about today. So that's what my plan is today, and I hope you will find it helpful, and I look forward to hearing your questions afterwards if there are any. Okay, I'll just get myself a bit better organised and we can start. Okay, so as usual, we just start by limbering up the rest of our body. So I'm just going to do some shoulder rolling and do some breathing. So hand on your chest and breathing in and breathing slowly out. And again, breathing in and then breathing slowly out. And then placing our hands around our rib cage and breathing in. So you're just pushing your hands out gently, breathing in. And then slowly breathing out. And again, breathing in. And slowly breathing out. And then lastly, we get round to the back of our shoulder blade. And we're going to breathe in right down to the bottom of our lungs. So you should feel your hands being pushed slightly backwards as you breathe in. So breathing in. And then slowly breathing out. And then we're going to do one last breath, and hopefully that will be a nice big breath and a bit of a sniff at the end. And breathing out. It's good to get those lungs working and exercising before you start. And then while I'm still turning sideways on, so you can see me, we're just going to do a roll down. So again, just bending the chin to your chest and then just slowly rolling down. Now, if you've got sore knees, you may not be able to go all the way down, which is absolutely fine. Just keep those legs straight or just comfortable. If you can bend your knees and reach for the floor, that's really great. Just let yourself hang, head nod, and then you can just come back up. As you come back up, roll those shoulders back, and just bring your arms up towards your air. That will help to pull your tummy in and tighten your bottom. Okay, so we're just going to do one more of those, so you can remember to pull in your tummy. So you're going to roll back down. Just go down as far as is comfortable, bending those knees a little if you can, but don't worry, you may not need to, but don't worry if it's too painful. Come back up, rolling right back, keep that chin on the chest for the last minute, roll those shoulders back, pull your tummy in, and pull that, tighten your bottom, and bring your arms up in the air, and then arms down. The next exercise is just to gently side bend to one side and then side bend to the other. We find when we're doing exercises that we do the action on the breath out, it just helps you get a bit more range, and it also just helps that pain a little bit. And you may just want to bring in the arm. Give yourself a bit of an extra stretch, and then back, and then the other arm. And then our usual thing we like to do is just to start off with some gentle marching on the spot. You don't need to lift your legs very far. Just gently marching on the spot. And then you can use your chair to hold on to while you go up onto your toes. I'm just going to move my camera so you can see a bit better. Okay, so we're just going to go up onto our toes. And I want you to pull in your tummy and use your bottom muscles. It shouldn't hurt your knees because your knees aren't really moving. So this should be a fairly good exercise. It works the whole of your body. It works your back muscles, keeps your posture good, bottom muscles, tummy. And as you're going up and down, you can think about each part of your body. So you can start by thinking about pushing down, pushing up through your foot, feet. And then the next time when you go up, you can think about tightening your bottom and pulling your tummy in. And then the next time you can think about pulling up through your back and making your neck long and reaching for the ceiling. And just repeat that process a few times. Usually between 10 and 12 for repetitions is fine. That's quite a nice exercise to do. When you've done that exercise, you may feel that you need to just give your calf a bit of a stretch. I'm just going to go to the wall here and place one of my legs backwards and one forwards, and then sort of like a lunge position. And then I'm going to push my heel into the floor and tighten my bottom. And that's what I call an active stretch. And that stretches out the calf really nicely. And for those who are struggling to get a bit of extension, it just helps to stretch out the soft tissue. And then you can do the other side as well. It's always worth having something to compare with. Usually we do the good side first, and then you can do the other side. The calf stretch is a really good exercise to be doing in the early stages following your knee replacement, and certainly before as well. Just trying to keep it as straight as you can, keep those soft tissues relaxed. While you're still standing, there's an exercise that you can do using, you can either use a pair of tights or a TheraBand, or even a long pair of socks for the gentlemen who don't have tights. And then you can just put it up to your side, just above your knee, so you're not hurting your knees. And if you just stand up against it, you can feel your bottom tighten up. And you can just sort of grow tall, and you can do a few exercises from there. Just really trying to pull that tummy in, getting your bottom working. And your bottom muscles are just as important as your thigh muscles. And then while you're standing there, you may just want to just do a few little abduction exercises to get those bottom muscles working a bit more. So this is the leg that is affected. You're either waiting to have done or just had done. You don't want to be standing too long on the other leg. And again, you can do about 10 of these. But again, it's just quite a nice exercise just to try and stand and just with your affected leg and just have that ability. Because sometimes when you get more muscle working around your bottom, it just takes that strain off the knee a little bit. It just helps to straighten you up, get your posture good. Because when we have our knee sore, often it affects other parts of our body. We start to collapse a little bit at the hips and around our back. So it's quite a nice way of just making sure we're keeping our postures good. While we're also in that position, we can also do a little bit, you try and see how you manage doing this little mini knee bend. Now, how you do that to take the strain off the knee too much, just take your bottom back as your knees go forward. As you can see, I'm not going very far, and this may be something you can do, it may not be. And I think it's good to have the suggestion there. It's something you can try. Good to keep those thigh muscles working if you can. So that's that exercise. I shall escape. TheraBands you can get through the internet, various places, sell them, so they're quite easy to find. Otherwise, as I say, a pair of stretchy tights or socks is a good one to do. Okay, so the other exercise thing to do next is to come and sit on the chair. And again, I would use a band, put it around your legs. You may want to do that sitting down. If you've got sore knees, you might want to be standing up. And it's quite, I'll come a bit closer. There you go. So just going to open and close your legs. So that again, you're using your thigh muscles. Stay grounded through your hips. Try and just grow tall through your chest. This is quite a nice one, just again to get those leg muscles working. And then you can do a bit of reaching. We've done this before. Just think about reaching one way or the other. Just keep those legs out. So you're just feeling the weight go from each side to the other. You can do a bit of rotation. So turn. Again, make sure you keep your legs out. As you turn, keep those pelvis straight and the tummy muscles working. And just move from the waist, remembering to breathe, keep your shoulders relaxed as you do it. Another exercise while you're sitting is to use a rolled up towel or a squashy ball. So you can get these squashy balls again easily on the internet. And again, a rolled up towel, which you make up into a square. And you can just push that, squeeze it between your knees. And you can push down through your feet at the same time, through your heels. And that just engages those muscles you want to really get working underneath, which are the inside of your thigh muscles. We call them the quadriceps, and also a little bit of your adductors. People always worry about adductors getting tight, but actually they're part of keeping yourself upright. So it's important that they stay relatively strong. Just squeezing for about 5 to 10 seconds, and then just relaxing. Letting go, just make sure you let the towel fall onto the floor, and then squeezing again. As you squeeze, just think about growing tall through the chest bone. Don't try and rock forward too far. Just remember to keep centered on your hip bone. As I say, the alternative, if you have got one, is a squashy ball, and that's that's actually a bit more comfortable, little less hard work on the old legs. And they're quite good, and they can be used for all sorts of things. You can actually use it in standing for your posture as well. It's quite a nice exercise to do if you're standing up. Putting it between your knees and squeezing it, and you just have a natural instinct to want to grow tall out of those hips and pelvis, and it really does help to get that posture really good. And you can even try a little bit, again, you might find with the ball between your knees, you can do a few little squats because it's just engaging those muscles a bit more. Some people find that that helps, and some people find that having the band or the tights around your legs is a better way. So either this one or the one I showed you earlier may be best for you. Okay, so those are the exercises so far. And now we're going to get onto the floor. If you can't get onto the floor, you may want to be on a couch or on your bed, whatever you find easiest. That's either is fine. And we're just going to do a few exercises for your knee. You can again use up the rolled up towel that you had earlier. And we're going to put that underneath the knee. And then you're going to straighten your knee. I'll just pull up my trousers so you can see better. Right, so there you go. Pull up. You can see that those muscles are really working. And then relax. In fact, I'll do it on the other side because then you can see the inside of my knee working, what we're working for. Right, so there you go. Can you see how those muscles there, right in there are working? That's what you're looking for. That's where you want to initiate the pain. Initiate the muscle from working. Quite often we get more work on the outside of our knee, but we really want to feel it there. right in the inside. Sometimes having a ball or the towel between your knees is quite good, because again, it engages naturally. So you're just going to push down, pull your foot and toes up towards the ceiling and squeeze that ball inwards. And then again, that helps to engage those inside legs. Because you haven't got much movement, it should help to reduce the pain levels that you have, but still keep those muscles strong. Make sure you completely relax between each repetition. And then we're going to go again, squeezing and then relaxing. The good thing is you can compare again which leg is the stronger one. Hopefully the one that's not going to be operated on is the stronger one. But even so, you can still work towards it and you've got something to compare with. There's certainly research to suggest that working the good leg and imagining how that feels on the other side does help to increase strength. So even though you may not be able to do it properly, imagining it happening, visualizing it can be a really good way of helping to increase your strength in the early days. So if we go back to that exercise where we had the towel under your knee, and again, you're just going to do, again, 5 to 10 second hold, and then just relaxing. Remember to pull your foot and toes up, and then let go. Again, make sure you fully relax between each repetition. And what I usually say is you start off with 5 second hold and do that 10 times. And then you gradually build up to about 15 seconds and do that 4 times. So that you're roughly doing a minute holding overall at one time. So these are probably exercises that you've learned to do before. But one of the things which is quite important, lots of people do find it quite hard to do properly. And so one of the things that I teach people is to actually push the knee down and then lengthen the leg as if you were sort of pushing your foot away from you towards the opposite wall. And that seems, and sort of almost like kick your leg up, kick that foot up into the air. And that seems to sometimes give people a good prompt as to how to do things. And sometimes by doing it on the opposite side, it gives people a good idea so that they can see what they're supposed to be doing. So doing repeating exercises on your good side first can again be quite helpful. It's sort of visualizing or seeing what you're doing on the good leg, and then you can do it, try it on the other side afterwards. So I hope that's helpful in just helping you to see how you can manage best to get those quadriceps working, the thigh muscles working. While we're on the floor, we're going to just do a few exercises for the back as well. So I think it's, and for your tummy exercises. So we're just going to be on the floor. And I hope you can see. Yep. So first of all, you're just going to just do some gentle side-to-side movement. Remember to breathe in and out. You should get a nice bit of stretching move from the waist. And then go to the other side. Remember to keep the rest of your body nice and relaxed. You're just working your lower tummy muscles. As I say, moving from the waist. And then back to the middle. And then the other one you can do to help with getting your tummy and bottom muscles working is just to do some gentle pelvic tilt. And if your knees allow it, which they may or may not, you can just peel off your bottom just a little way and then slowly back down again. And again, keep your top half nice and relaxed. You're going to drop your belly button to the floor and peel your bottom off the floor. And again, you want to hold it for about 5 seconds or so. And again, you can repeat these depending on the comfort of your knees for 5 to 10 times. Another good exercise to do while you're lying here is just to let your knee roll out to the side, but you're keeping the other one completely still. And you're only going as far as you can control. This is quite a nice exercise to do for controlling your tummy muscles. And it shouldn't be too much strain on your knees. If you need to have your legs slightly less bend, that's fine. We're still just keeping an eye on our pelvis, but it's not moving. And remembering to keep the rest of your body nice and relaxed. So those are the exercises to do when you're lying down on your bed or couch, or even on the floor, but I expect it's quite difficult to be on the floor. So be somewhere where it's comfortable. And then you can finish off again with a roll down. I'm just going to roll your chin to your chest and then roll down. Letting those arms and heads relax. And rolling back up again. And bringing your arms up off your head. So the key points there are to do exercises that are minimal movement for your knees if it's painful to move them, and to try and keep those soft tissues behind the back of the leg particularly as mobile and flexible as possible. Hence the reason for the calf stretches. I can just show you again. We're going to just again be in that lunge position and just stretch that, push the heel into the floor, and you can count for up to 15 or 20 seconds if that's comfortable for you. If you tighten your bottom, push the heel into the floor, you'll also feel your thigh muscles at the front working, which is all to the good. So again, do the other side. Pushing the heel into the floor, tightening your bottom. Remember to keep a nice posture at the top. Keep your head towards your back. Good. And then finish there. One last little exercise that you may want to try, depending on how confident you are with your knee, is just doing little curtsy. And again, that's just being very small. I'm just giving a few suggestions for people who may be able to do a little bit more than what the average person maybe can do at this stage. I'll turn around so you can see that from a different angle. So again, bottom goes back and your knee goes forward. Doesn't matter whether it's two knees or whether it's just the one. And as you can tell, I'm not actually, put that again so you can see better. So I'm not actually necessarily going down too far. It doesn't have to be too far. I don't want you to be forcing the issue. But we know that if we keep that sort of exercise going, it doesn't do too much. It doesn't do any harm to the knee. It just helps to get it stronger, if anything. So keeping your knee in alignment, in touch, in the same line as your foot, whether it be through your squat. Keeping those knees going forward as opposed to falling in. You want them to be out a bit. And again, with the single leg, it's going to be onto your toes at the back, a bit like a curtsy. And again, you're relaxing from the top half. Okay, so that's your basic exercise program for knees. And as always, we like to finish with a bit of relaxation. I think it's always good to, when you've been doing some exercises, to also know how to relax. And I think we certainly know that it helps people who are struggling with pain to give their body a chance just to completely relax. So we'll just do a little bit of relaxation for the end. So you just lie yourself down wherever you feel comfortable, if it's sitting or lying on your couch or on your bed. Resting your head on something comfortable like a cushion, pillow. Then you're going to concentrate on your breath and breathing. So breathing in for 5, 4, 3, 2, 1. And then breathing out for 5, 4, 3, 2, 1. And again, just repeat that a few times. Feel what it feels like to have your chest rising and falling. How does it make the rest of your body feel? Can you feel your back beginning to rest back on the floor or the bed? Can you feel your muscles around your legs beginning to let go as they're resting? And one of the things I should say is maybe having a pillow under your knee, maybe make you feel more comfortable so that you can have your legs completely comfortable. And then as you're lying there and breathing, think a bit more about breathing in and breathing out. And you're going to do the body scan. Just to run down your body as you're lying there. Do you feel any tension? Do you feel any pain? If you do, that's normal. And I want you just to concentrate on that area and breathing in and out to see if you can make a difference to that pain, or your body makes a difference as you breathe in and out. And then you can either, today we're going to start at the top of the body, just pushing our head, back of our heads gently into the pillow or cushion. See what it feels like to be slightly tense around the neck. And then let go of those neck muscles. Rest your head back on the pillow. Let's just do it once more, just to feel those muscles at the back of your neck being stretched. And then let go. And then bring your shoulders up to your ears. Breathing in and breathing out as you let go. And again, you're going to breathe in. Breathe in with those shoulders, bring them up to your ears. And let them go as you breathe out. Let your shoulders rest against the floor. Maybe just pull your shoulder blades back. You could feel the tension in the middle of your back. and then just let them go. Then we move down to the pelvic area. You're going to squeeze or tighten your bottom muscles, maybe your thigh muscles together. Often they work best together. Hold them as tightly as you can, and then just let them go and feel that change in the muscle. Let them maybe just let your knees roll in and out. You can just feel those muscles loosening off. And you're just going to pull your foot and toes up to the ceiling and point them down to the floor. And then just let your heels rest on the floor. Let your legs go all floppy. And again, go back to your breathing, your chest rising and falling. Just see if you can slow your breath down a bit more. You can see or feel any difference in the body. Is it less tense, less painful? And as you're resting there, think of a place where you go, where you feel easy and comfortable, like what you enjoy doing perhaps. Just think about something that you enjoy doing, or somewhere where you'd like to go, somewhere where you can look forward to going, or an activity that you can start doing again when either lockdown is over or when you've had your knee replaced. Just think what it feels like to be doing that particular exercise or activity. It feels like to be outside again. It feels like to be fit and healthy as you were. Because that's what's going to be like. You want to remember that. Keep that thought in your mind. Just think for a minute, something that you enjoy, what you're looking forward to doing again once your knee pain is feeling better, so you can get out and about again. Okay, thank you very much, Axel.
Super. Now, there we are. Oh, that was wonderful. Thank you again, Helen.
You fell asleep, did you?
Well, not quite, but almost. Relaxation, kind of, yeah. I'm getting into the swing of it now. I should be learning faster, really. Though this is, while everyone else is relaxing, I need to be getting primed to round off today's session. Well, that was fantastic, really. We covered some good things before, and some questions before. Is there anything you'd want to add in terms of modifications and things to this session? I think you covered quite a lot as you went through.
Yeah, I think it's a fairly basic exercise program. So the modifications that I've shown before were things that you could do that were easier. I don't think you would want to change things much in this session. But again, I would, keep safe. So whatever exercises you're doing, make sure that you've got somewhere to hold on to and don't push into the pain. Mm-hmm. This is not an exercise class where we want to cause pain. We want to keep the pain under control. So that, I think we talked about last session about where the pain should be in. Mm-hmm. It's fine to have probably go up to 4. If it goes back down to 2 or 1 afterwards, that's what we're aiming for. So we don't want you to be in pain for hours after these sessions. So please just do what you feel is right for you.
Yeah, and we did indeed touch on that in the previous sessions. But yeah, that's in the typical score from 0 to 10. That's what that kind of that rough general guideline is. And so something that you touched on that I just thought it might be worthwhile doubling back on quickly is around which side to exercise, because I know that often pops up as a common question. If you've had left-sided knee replacement or hip replacement, for example, and you're given a set of exercises, generally speaking, should you do them on both sides? Should you do what's the general advice there?
I think in the early stages you can't really stand. If you're doing standing exercises, it's difficult to weight bear through the side that's just been operated on. So on the whole, you're just working the side that's been operated on. Later on, as you begin to become more confident and stronger, then yes, you should be doing it on both sides. I think I mentioned in the exercise class when we were doing the exercises on the non-weight bearing exercises, I think it is actually quite helpful to do them on the good side first, so that you can see what you should be doing, and then to do them on the other side, so you've already got in your brain how I should be doing them. So the visualization of good technique or what's normal for you is a really helpful way of getting the other leg to work really well.
And of course, if for our viewers out there who are tracking their exercises in their Joint School app, you can decide yourself whether you track the number of repetitions that you're doing just on the operated side, or whether you're counting the sort of the total amount, so to speak. It's as with the rest of the app, it's the tools are there for you to use in a way that makes sense and that works best for you. So there's a few different ways of doing it, and equally it's about, as with anything else really, it's about finding a way that works for you.
So some people may find that they can only do one set of reps, so we like to try and do, as I say, between 5 and 10 of each exercise. Some people find that that's all they can do. Other people may find that if they give themselves a rest for a minute or two between each exercise, so that they can actually come back and do another cycle. So again, that's something to bear in mind if you particularly want to, say, spend a particular length of time exercising. You could try that, but there's a warning of not overdoing it.
Super. Well,
maximum 3 sets, I would say.
Yeah. Well, thank you so much for that, Helen. And you'll be back again for another session next week.
I gather so, yes.
Yeah, yes, indeed. And that session has been inspired by someone who sent in a question, and they found the videos we've done so far very helpful. But in their case, they have quite painful hips on both sides, and so they're particularly requesting that we do something sort of what we've done today, but with a bit more of a view with problematic hips on both sides.
Great, I look forward to that.
Yeah, as will I. Fantastic.
Something like a challenge. Take care. Bye.
Take care. Bye now. Have a great week until then. And
Thank
bye. Be well and stay safe out there, and keep up the good work. Track your progress in the app, and send us questions and suggestions and topics for ideas and things to cover, and we'll get to them, and we'll have fun doing it. Bye now.
Great. Bye.